Are schools providing enough support for genetic special needs? Imagine a child struggling to learn and feeling misunderstood because their learning difficulties are linked to genetics. Now, ask yourself, are schools doing enough to help children like this? Many children with genetic conditions that affect learning face challenges that go beyond typical classroom struggles. Conditions like Down syndrome, Fragile X syndrome, or Williams syndrome can influence how children think, learn, and behave. Despite this, schools often relying on traditional teaching methods that may not address these specific needs. Research shows that genetics play a big role in learning abilities and disabilities. For example, genetics can explain a large part of why some children find reading or math more difficult. But schools tend to focus on addressing symptoms rather than understanding the underlying causes. This means interventions are often generic and not tailored to each child's genetic profile. Teachers usually do not receive enough training in genetics or how it relates to learning disabilities. Without this knowledge, they may find it hard to adapt their teaching methods or recognize when a child's difficulties are linked to a genetic condition. Limited professional development means many teachers miss opportunities to use genetics-informed strategies that could help children succeed. Genetic testing can confirm diagnoses and help decide what kind of support a child needs. However, many schools do not use genetic information when creating individual education plans. This means children might not get the personalized help they requiring, which could improve their learning experience. Support for families is another area that needs improvement. Parents of children with genetic learning disabilities often face emotional stress and may lack access to resources that support their child's education and family well-being. Schools rarely provide comprehensive services that address both educational and emotional needs of families. Overall, while some support exists, it is not enough to match the advances in genetic research. Schools need better training for teachers, more integration of genetics into curriculum planning, and stronger support systems for families. These steps would help create more personalized education plans, making learning easier and more effective for children with genetic conditions.